Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristin Schwarz, licensed midwife and MC here at Gold. And today I'm chatting with Dr. Miriam Pettersson. Welcome, Miriam.
Thank you.
It's so wonderful to have you here today with us. You are part of our Gold Midwifery online conference, and I can't tell you how excited I am as a midwife that we get started just around the corner on February 2nd. We will have our open access keynote presentation kicking off the conference, and you are part of this wonderful conference, and your topic is bonding and safety and savings, the case for home-based phototherapy. And I want to jump into that topic in just a moment. First of all, Miriam, tell us where in the world you are and tell us a little bit about your professional background.
Well, as you said, my name is Miriam, and I work as a pediatrician and neonatologist in Sweden, in a town about 2 hours south of our capital, which is Stockholm. And I've been working as a neonatologist and a pediatrician for about 20 years. And I've,
Wonderful.
I've also done some research, and my research has been centered on just home phototherapy.
Wonderful. Wonderful. What a great topic because, um, you know, uh, it is such an important aspect of caring for a neonate, especially with jaundice, of course. And I feel like there is so much we can do, but also we need the research, right? So that's where you come in to present us evidence-based information on the topic. So um, tell us a little bit about your research, first of all.
Well, my research has been focused on trying to show you how to implement home phototherapy and also um, finding a routine that actually works, implementing this program at your hospital. And it's been focused on safety and efficacy and also cost effectiveness and bonding and parental experiences.
Yes, wonderful. And so tell me, when you started your research, did you feel like hospitals were right on, like, oh, wonderful, let's do this? Or did you experience some barriers or some pushback? How did that go for you?
Well, home phototherapy has been part of some hospitals' program for a lot of years,
Hmm.
but it hasn't been widely spread, at least not in Sweden and also
Hmm.
not in a lot of other countries. And so I felt that we needed to have more research to be able to prove that this is something that is good and safe. And I think that my research has helped to show that, and also has been able to been used to help implement the program at several other hospitals.
That's fantastic because we need that evidence, right? To be
Yes.
able to implement something into practice. It is
Hmm.
always good to have that research at hand, and also for midwives who want to maybe make sure that the parents they're serving, their little ones have access to this and get to know about it and maybe have it implemented in their hospitals. It's good to have that research in hand so they can go and look, this is working, this is safe, this is
Yeah.
effective and great for bonding. So it's a wonderful tool to help us to spread this further in the world.
Yeah.
Hopefully, eventually every hospital has that, or everybody has access to that.
Yeah. Well, that is my main hope, really, that this will help a
Mhm.
lot of people to implement the program.
Right. And this is fantastic that you're sharing this here with us at Gold, because then we can share this information with our viewers worldwide and, get them excited about this program. Um, Let me ask you this. What assumption clinicians always make about the safety when it comes to home-based phototherapy? Do you get that people feel like it is not as effective as in hospital? Share a little bit with me what you have seen in practice and also maybe when talking to other care providers.
Well, I think a main thing with letting small newborns go home and performing home phototherapy is a sense of loss of control for
Mm,
pediatricians and also for midwives and nurses, because you actually hand over a lot of extra responsibility to the parents to actually perform the treatment.
hmm.
And so I think what's really important is actually find a way to hand over the responsibility in a responsible way to actually
Hmm.
help the parents to feel safe doing it. And also, you have to have a program that helps you maintain some control with either um, visits at home from midwives or nurses, or actually having the parents come back for daily revisits to actually have maintain some control to see the bilirubin levels decline
Mhm.
and to see that the baby actually improves.
And that's why it is so important to have a good protocol in place, right?
Yes. Hmm. And
Absolutely,
I mean, there
absolutely.
are no national, I mean, there are no universal national guidelines as of today, and that's one of the things that I think is necessary
Hmm.
to find. And this is a way to do it, to do
Hmm.
research and to implement it at hospitals and build up a lot of experience, and then hopefully we can reach a place where we can have a national guideline.
That was actually my next question because I wanted to ask you if there are any national guidelines or internet, something that are widely established, but you're saying there isn't quite yet, and that's where the research is so beneficial because we can establish it with that.
Yeah. Actually, we've just implemented a national guideline in Sweden, but it's not, but there is no national guideline in the United States and a lot of
Hmm.
other countries. And
Hmm.
so I think this is something that can be improved over the coming years.
Absolutely. Absolutely. I love hearing that.
Mm.
Um, Now, what have you experienced with regards to the parents? I can see that many parents are probably, wow, this is wonderful. We get to go home. The baby's home with us. But is there also some, concern from parents that they feel like this is a lot of responsibilities and what if I do it wrong or if you don't do it right? So tell me a little bit about the parents here.
Well, I mean, the majority of the parents that I've met over the years that we've had this home-based phototherapy program at our hospital, they are just really safe and feel secure doing this at home. Of
Mhm.
course, we do give them instructions before they go home, how to use the equipment and how to contact us if they have any problems doing the phototherapy at home. But I think a really important part of the program is to actually ask the parents, are you feeling up to doing this? So home phototherapy is not for everyone. You will always have some parents that feel unsafe and they really just want to stay at the hospital. And I think you should let them. So home
Mhm.
phototherapy is for the parents that feel that they can actually do this. So it's not a program for everyone. It's for a selected group of parents and a selected
Okay.
group of patients.
Absolutely. And that makes a lot of sense too, because, not every case is, we can't say that everybody should have that if we feel like this, the
Mhm.
parents feel that they're not up to it or they feel it's overwhelming to them, or, if there's any concerns for the baby as well from
Right.
a clinician side as well.
Mhm.
So what are you, first of all, give us a little bit of a tip here. What are you hoping our viewers will take away from this presentation? And if there's one thing you wish our viewers will really learn from it.
Well, I hope that they feel that they know a little bit more about the recent research and that the that they will feel secure in that it is a safe and a secure treatment to perform, and that also they will take away that this will be like a tool that they can use implementing the program at their hospital.
Wonderful. Well, Dr. Miriam Pettersson, it's been such a wonderful time having you here today talking about the work you do in Sweden, the research, and of course, this presentation here at Go. Thank you so much for being here today.
Thank you.
And now some information for our viewers. If you're curious about this presentation and would like to know more about it and about all the other presentations in the conference, we invite you to go and visit goldmidwifery.com for all the information there. As I mentioned, February 2nd, our free keynote presentation will kick off our conference, so everyone is welcome. You will find the information there as well at goldmidwifery.com. Please share that free keynote with all your friends and colleagues in the field. We want to make sure that everybody has access to the information. And we hope to see everyone at the conference. Thank you all for watching. Bye bye, everyone.